Hello, I'm Dr. Nayantara Das, Consultant and Head of Department of Emergency Medicine at Manipal Hospital Baner. Today I'll be talking to you about a very important topic, that is CPR or Cardiopulmonary Resuscitation. So why is CPR important? When the heart stops, time is your enemy. Even 5 minutes loss of blood supply to your brain can cause your brain cells to die, which is why it's important to act fast and in the right way. So how do we do this? If you come across someone who suddenly becomes unresponsive, the first step would be to ensure scene safety, which means that ensure that the area is safe for both you as well as for the patient. Secondly, you want to check for responsiveness. You check for responsiveness by tapping both the shoulders of the patient and calling out loudly if they are okay. This is the ideal way to check if the patient is responsive or not. If the patient is unresponsive, your next step would be to call for help. Immediately reach out to your nearby hospital or call for an ambulance immediately. The next step would be to check for pulse and breathing. Checking for pulse is very simple. You take 3 fingers of your one hand, feel the center of the neck of the person, move it 3 centimeters to the right and feel for the pulse. Feel this for a minimum of 5 seconds and a maximum of 10 seconds. While you're doing this, also make sure that you're looking at the chest to see if the chest is moving with respiration. This is how you check whether the heart is beating and if the lungs are functioning fine. If both breathing and the pulse are absent, that is your time to start CPR. Now CPR, Cardiopulmonary Resuscitation, means that we are going to be trying to artificially get the heart and lungs to work. How would we do this? It's a combination of chest compressions as well as breaths. I will be talking to you today about hands-only CPR, which is only chest compressions, which is almost as effective as the original type of CPR. What you need to do is place the heel of one hand on the center of the chest and use the other hand and interlock the fingers. Ensure that your elbows are straight and your shoulders are in line with your hands. This is the ideal position to give CPR. You need to push down hard and fast on the center of the chest of the patient. Now, a few things to remember while you're doing this. Number 1, the position of your hands and ensuring that the elbows are straight ensures that you're giving high quality CPR. Secondly, you need to ensure that the chest is compressed to a depth of 5 centimeters at least. This being said, you need to also ensure that the chest recoils completely those 5 centimeters that you have pressed. This ensures that the heart is not only being pumped but also being relaxed. Next, the rate at which you need to give this is 100 to 120 per minute, which means almost 2 pumps per second, which is a little bit faster than your original heart rate. And lastly, the ratio in which you need to give it. If you are using compression and breaths, you need to give 30 compressions followed by 2 breaths. Lastly, the important thing is to not panic in this situation. Follow the steps of basic life support and you could be the difference between life and death for that person. Ensure that you continue the CPR process until either the patient becomes conscious or medical help arrives. Thank you.